Hi, my name is Rachel O'Brien, and I'm one of the Pediatric Emergency Medicine Fellows at Inova Fairfax Hospital. I'm excited to present my research to you today, even if it is virtually rather than in person. My research study is entitled Bladder Point-of-Care Ultrasound, a Time Saver in the Pediatric Emergency Department. Ultrasound is frequently used to identify sources of lower abdominal pain in females presenting to the emergency department. In pediatric patients, transabdominal imaging is typically performed rather than transvaginal, and this requires a full bladder as an acoustic window. Bladder fullness is subjective, and to date, patients have been relied upon to identify when their bladders feel full enough to be sent to radiology. Often patients are sent to radiology before their bladder is full enough and are then returned to the ED for further filling. This leads to delays in imaging and diagnosis, decreased patient satisfaction, and increased costs. Prior studies emphasized the need for a full bladder to use as an acoustic window, but there is limited information on what actually quantifies a full bladder and how this is best assessed. The primary objective of the study was to determine if point-of-care ultrasound to evaluate bladder fullness decreases time to pelvic imaging. Secondary objectives include determining if POCUS decreases ED length of stay and failed first attempts at imaging, as well as evaluating the agreement between patients' subjective feeling of fullness and bladder fullness based on POCUS. Female patients ages 8 to 18 years old presenting to the PEDS with lower abdominal or pelvic pain and undergoing transabdominal pelvic ultrasound were included in the study. Patients were excluded if they were pregnant, nonverbal, had bladder anatomical abnormalities, or urinated prior to imaging. Patients were also excluded if they had a transvaginal ultrasound performed. The control group, which relied solely on the patient's subjective feeling of fullness, was obtained by a retrospective chart review from January to March of 2018. POCUS to evaluate bladder fullness was implemented in February of 2019, and the study was completed in October of 2019. A total of 105 patients were included in the control group, and 40 were included in the POCUS group. 2 patients were excluded in the POCUS group, one for urination prior to imaging, and one who had a transvaginal ultrasound completed. Bladder volume was assessed using the phased array transducer on the Sonocyte export machine. Assessments were made every 30 minutes from the time the pelvic ultrasound was ordered until the bladder appeared full by point-of-care ultrasound. The transducer was placed directly superior to the patient's pubic symphysis with the probe marker oriented towards the patient's head. If the height of the bladder was equal to or greater than the height of the uterus in the sagittal view, the bladder was considered full, such as the image on the left. Patients were also asked about their subjective feeling of bladder fullness at each time point. The POCUS group demonstrated a decrease in mean time to pelvic imaging by 38.7 minutes and a decrease in ED length of stay by 49.2 minutes. Both decreases were statistically significant. Among the POCUS group, there was a lower rate of failed first attempts at pelvic imaging where the patient was sent back to the ED because their bladder was not full enough. A weighted kappa was also calculated to evaluate the agreement between the patient's subjective feeling of fullness at each time point and bladder fullness based on POCUS. The weighted kappa value across these time points was 0.04, indicating poor agreement between the patient and POCUS. From this study, we can conclude that POCUS to evaluate bladder fullness by comparing the height of the bladder to the height of the uterus reduces time to pelvic imaging and therefore ED length of stay. This is likely multifactorial. POCUS patients had less failed first attempts at imaging. Additionally, there was poor agreement between the patients and the POCUS on assessment of their bladder. This indicates that patients are not reliable in identifying when their bladder is full, and relying on patients to identify a full bladder leads to time delays. Thank you for tuning in, and thanks to everyone at ANOVA who helped me complete this study, especially Dr. Cathy Chung. If you have any questions, please do not hesitate to email me. Thanks and have a great day.